The hardest thing for a guy when it comes to Peyronie's disease is coming into the doctor to talk about it. We're much better at it now. I think guys are way better at it now than they were 5 years ago, 10 years ago. There's some advertisements about this. We're trying to normalize the topic, destigmatize any issues with it, break any taboos, all of that.
June is Men's Health Month, and to kick it off, we'll be covering a condition that has provided frustration to a significant number of men, and for many, are too embarrassed to even bring it up to their physician. Well, today, I'm excited to be bringing to our podcast nation an expert in men's health to get you up to speed regarding the condition known as Peyronie's disease. So stick around, and we'll get right into it as soon as we get back from thanking our episode sponsor today. As we enter into a new frontier of testosterone replacement therapy, there is now a convenient, safe, and effective option with Cedars that can be taken in pill form, allowing patients another option other than messy gels, painful injections, or surgically implanted pellets. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is a question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Houman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm excited to introduce to our listeners today Dr. Justin Houman, who is a board-certified, fellowship-trained urologist in Los Angeles, whose mission is to enhance men's quality of life by improving their sexual, reproductive, and hormonal health. In addition to urology residency training at Cedars Sinai Medical Center, he completed fellowship training in male reproductive medicine and surgery at UCLA Medical Center. He has published numerous manuscripts on men's health, male fertility, and the effects of wearable technology. He has also presented his research at the national and international level. His focus is on making a difference in people's lives through state-of-the-art, compassionate, and personally tailored care. Dr. Houman, welcome to the Prostate Health Podcast.
Thank you very much for having me.
So while a substantial focus of the Prostate Health Podcast is really dedicated to prostate health, including new technology for BPH and prostate cancer, we've been able to include episodes highlighting various men's health topics, including sexual dysfunction. I'm excited to be covering a condition today that, depending on the severity, can have a significant impact on a man's sexual health. Dr. Houman, Peyronie's disease is a condition that both you and I manage in our urology practice. For our listeners that are unfamiliar with the condition, I was going to see if you could first explain what is Peyronie's disease and what are the presenting symptoms?
So Peyronie's disease is something that is becoming increasingly common. I'm sure you could attest to this in terms of clinically seeing it. I think probably like 10, 15 years ago, we wouldn't necessarily see it as much as we do now. So essentially, it's a pathological curvature of the penis. Typically, it goes upwards, dorsal curvature, we call it, sometimes left, sometimes right. And in less common cases, it goes down. The curvature goes down. Now, no penis is perfectly straight, but Peyronie's can inhibit a person's ability to insert for intercourse. It could cause pain at the site of the curvature. It could lead to penile shortening, erectile dysfunction, amongst others. Those are the main reasons why guys come in complaining of Peyronie's disease.
So again, with Peyronie's disease being a benign condition, I think that's important to highlight, and I've seen a lot of men in my practice that come in because they notice a palpable lump and are very definitely relieved when they hear that this is not cancer. Now, with that being said, it's still very important for men to not ignore any new changes they note with their anatomy and to seek medical attention. Dr. Houman, are there any risk factors for developing Peyronie's disease?
Yeah, so two main reasons or two common reasons why guys get Peyronie's disease. Number one, it's trauma. So we've all heard of penile fractures. So aggressive intercourse, amongst other things, while you're erect can lead to a fracture or damage to the corporal body, to the outer layer of the erectile body. And what that happens is your body's going to try to heal it. It heals it with scar, collagen, and it develops this plaque on top of that area that was beaten up. So that leads to plaque formation and therefore could lead to Peyronie's disease. That's number one. Number two is some guys, they're genetically predisposed to this. So we're learning about this more and more. So guys of Northern European ancestry, generally in their 50s, 60s, and 70s, they'll develop this. Guys with Viking blood, actually, guys who have Viking lineage, they're genetically predisposed to this as well. And it's not just plaques on the penis. They'll get plaques on depoutrins, contractures on their hands, sometimes on their tympanic membranes in their ears, sometimes on the plantar fascia of their feet. They'll develop these plaques. But being that the penis is so important to any guy, that's usually the first sign, the first thing that they notice and makes them want to see a doctor.
What does your typical evaluation consist of in diagnosing men with Peyronie's disease?
The hardest thing for a guy when it comes to Peyronie's disease is coming into the doctor to talk about it. We're much better at it now. I think guys are way better at it now than they were 5 years ago, 10 years ago. There's some advertisements about this. We're trying to normalize the topic, destigmatize any issues with it, break any taboos, all of that. But the workup is generally pretty straightforward. It's a physical exam to see if there's any plaque on the penis. That's an important part of the exam to see if they actually have a plaque. I like to discuss their erectile function. Are they having any issues with their erectile function? I also like to do a hormone panel on them to see what their testosterone levels are. There is some evidence to suggest a guy's response to Peyronie's treatment options. The higher your testosterone levels are, or you have normal testosterone levels, you'll respond better to some of the treatments for Peyronie's disease. And then finally, there's something called a penile ultrasound, where we induce an erection, and after inducing the erection, we'll measure the degree of curvature of the penis, and then basically gauge where you are, and then we'll be able to gauge where you are after the treatment.
So before we get into treatment options for Peyronie's disease, we're going to take a quick break here to thank today's episode sponsor, Marius Pharmaceuticals. Then we'll be right back to finish out the episode. Until recently, our options for testosterone replacement therapy have involved modalities including messy gels, painful injections, and surgically implanted pellets. Men are now excited to finally have a comprehensive option with Kyzotrex that is convenient, safe, and effective. When I talk with patients, most would rather just take a pill with their daily prescription and/or supplements, particularly considering some of the drawbacks with prior options, including taking a pill doesn't involve a needle causing pain, and there's no risk of transference to someone coming in contact with your skin like you have with the gels. Make sure to ask your physician about Kyzotrex, and to learn more, just go to kyzotrex.com. All right. Well, thanks again to our episode sponsor today. Okay, so now after the diagnosis has been made for Peyronie's disease, could you walk us through the typical your in-office discussion you have with these patients regarding your treatment options for the condition?
So again, because Peyronie's disease is becoming increasingly common, 10 to 15% of guys have this, we have good options for it. 3 main options. Number 1, do nothing about it, right? Continue to observe it. In rare cases, it gets better. But in most cases, it either stays the same or it gets worse. That's option number 1. Option number 2 is the Xiaflex. So what the plaque on the penis is collagen. It's a type of collagen. Xiaflex, it's a brand name for basically it's an enzyme called collagenase. It's an enzyme that breaks up that collagen. So by injecting, it's a series of 8 injections over 6 months. By injecting that plaque, we soften that area and then, or leads to decreased curvature of the penis. So Xiaflex is option number 2. And then number 3 is a penile plication. So this is, if you came in 15 years ago, this was the only option that we had. It's a surgery that basically we will put sutures on the other side of the penis. So if your penis goes upwards, we'll put sutures, tacking sutures on the underside of the penis, therefore straightening the penis. However, this does lead to some penile shortening, and it's a surgery, so it requires a few weeks recovery time before you're able to engage in intercourse again.
So lastly, you'd mentioned one of the surgical option with penile plication. From a surgery standpoint, what can a patient expect in terms of recovery from surgery?
After the plication?
Right.
So the plication is a less common option these days, but they'll expect some degree of penile shortening, a much straighter penis as a result of the surgery. And the recovery, as I mentioned, is probably a few weeks. I'd say most guys are able to start having intercourse within 3 to 4 weeks with a straighter penis and a slightly shorter penis.
I thought we could just also briefly touch on another surgical option, graft excision. I was going to see if you could update our listeners a bit about this option and what it entails.
Yeah, so the other thing I didn't mention actually is the plaque excision and graft, which is usually for extreme cases. And that's when you have a calcified plaque. In that situation, it's basically that collagen has become bone. So therefore, we remove that piece of bone and we put usually some kind of pericardium, cadaveric tissue or pericardium on that area in order to close it. So in terms of how it compares, you'll have less degree of penile shortening after the plaque excision and graft. There are risks associated with it. One of the main ones is erectile dysfunction, because as you imagine, the erectile bodies are balloons. We're cutting off a piece of that balloon, putting on another layer, and the hope is that heals up nicely. In rare cases, there's a leak in that balloon, therefore guys have erectile dysfunction as a result of it. However, if it's done there, if you go to somebody who does these surgeries pretty regularly, the chances of that are obviously less common.
Well, we really appreciate you taking time really out of your busy schedule to share your expertise today on Peyronie's disease with our listeners on the podcast. Dr. Houman, any final thoughts today before we wrap up?
Yeah. The one thing about Peyronie's disease is it's a lot more common than most guys think. Like I said earlier, I think the hardest part is making that first call with your primary care doctor, with your urologist, your men's health physician, whoever it is. It's a lot more common than you think. And the good thing is we have great options for it. Xiaflex is a great option. In some cases, surgery, but sex is important, the penis is important, and let us help you fix it.
We've definitely delivered a lot of value today for our listeners. Thanks again for joining us on the show.
Thank you. Thank you for taking the time.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.